Hi everyone, I'm back here. So now I'm going to explain few important topics in relation to growth and development of orthodontics. So first of all, dealing with growth. So basically in this particular topic, we need to learn about individual scientists and what the tagline they have given for growth. So all the many clinicians have defined growth in a different ways. There is no universally accepted definition of growth. And these are the following clinicians which has given or defined a growth. So please do just have a look, okay? Don't try to mug up some, you try to identify the keyword and try to remember the scientist name. So preferably an increasing in size is called as growth was given by which scientist. So such questions are most common in this particular area. So please do make a note about these lines and the scientist names. Like simply give the line. Okay, increasing in size, change in the proportion, and progressive complexity, which is called as growth, was given by which scientist is the most probably asked question in this area. The next comes is in most of the cases, the growth is just an increasing in size. But there are few cases where you can see growth can be regression. The best example is the thymus gland, okay, which decreases in size as age increases. The next comes is the development, okay. So these are the two scientists which has given or defined the development. Okay, one is refer to all naturally occurring unidirectional changes in the life of an individual from a single cell, which is a zygote initially, that is the fusion of the sperm and ova, which is later converted into a multifunctional unit, that is the body. Okay, so Todd has given it is progression towards maturity. The next comes is the differentiation. It is change from generalized cell or a tissue to more specialized kind of tissue during the development. Like initially, if you see your embryonic cells, they are generalized cells. Later, by the stimulus, these generalized cells are differentiated into different types of cells, and each cell has its specific function. Similarly, like we are like dental students, the ones we are done with BDS. It is something like a generalized thing. So once we are done with the BDS, we'll go to the next level, that is MDS, where we are going to convert into some specialty. Okay, so this is something called as differentiation, means converting a generalized stuff into more specialized stuff. And okay, this is a good area where you can see a number of questions which were previously repeated in examination point of view, and of course this is a 4 marks question for us in the university exam. Okay, so growth doesn't takes place uniformly at all the time. Okay, it varies at few in a particular duration of time you'll have an enormous growth, in a particular duration of time you'll have less growth. Okay, there seems to be a period where there will be acceleration of growth followed by there will be sudden increase in the growth or a slight increase in the growth. It's not constant. Okay, so that area where there is a sudden increasing in the growth is called as growth spurts. So these are the areas which we have in our life where there will be an enormous increase. One is just before birth, and the second one is 1 year after birth, and the third one is mixed dentition. For boys it is 8 to 11, for girls it is 7 to 9, and prepubertal growth spurt, that is in the guys it is 14 to 16, in the girls it is 11 to 13 years. So what is the clinical importance of this particular age? This particular age is most of your functional and orthodontic appliances, it is better, they show a better response during this particular age group. So that's the reason why most of your ortho treatment are done before the pubertal growth. Before the pubertal growth, most of your orthodontic treatments are done because it encourages or it responds well for your treatment outcome. And for example, if you're planning any surgical corrections that includes the maxilla and mandible, they should be carried out only after completion of these growth. Most of your permanent surgeries in the maxilla and mandible are done after the growth of maxilla and mandible, preferably after 14 to 16 years of age. The next comes is differential growth. As already discussed, growth is not uniform. Okay, it doesn't grow at the same rate throughout the life. Different organs has different growth and different amount of growth, difference in the size, difference in the time, and everything. These things are well explained by these two curves. Okay, one is cephalocaudal curve or cephalocaudal gradation growth, and the second one is Simon's growth curve. So we'll discuss in detail. Okay, this is the cephalocaudal, means how the growth will be from head to the tail. Okay, how it varies. Okay, this particular growth simply means that there is an axis. There is an axis in the body. There is an axis in the body which helps in determining the growth, which helps in determining the growth of an individual. A comparison of body proportions, prenatal, postnatal, is going to give an idea of this particular hypothesis. For example, if you take the individual, preferably at 2 or 3 months of intrauterine life, head occupies 50%. You can see head occupying 50% of the total body length, particularly around 2 to 3 weeks of intrauterine life. But as at the time of birth, if you see at the time of birth, this is at the time of birth, okay, the occupancy of head dropped down to 30%. When it is converting into adult, an adult, it dropped down to 12%. Means at 3 months of intrauterine life, the head occupies 50%. Whereas at the birth, it occupies 30%. Okay, and coming to the next level, at the puberty, at the age of adult, it occupies only 12%. So there is a decreasing in the occupancy of the body surface area or the proportion of the head when compared to the intrauterine life to the adult. Similarly, if you take the lower limb, okay, in lower limb, in the uterine life, the lower limb is rudimentary. Okay, it doesn't have, your lower limb doesn't have any aspect. It is considered as rudimentary. But as increases, the lower limb occupies more than 50%. You can see it here, it is rudimentary where it occupies the 50%. This is not only in the particular zone of the entire body. Even if you want, you can compare this. Okay, you can see this. Okay, there is an growth evidence even in the head and the face. At birth, okay, at birth, the cranium is in you can see, like this is at birth, the cranium occupies a major content. Okay, a major content when compared with the face, which is also less. But as age increases, your face will increase in the proportion when compared to that of the cranium. So this can be seen in comparison of the cranium to that of the face also. The next comes is this is the growth curve. Okay, the growth curve. So there were few diagram based questions asked in relation to this growth curve also. They have simply without giving a title, they have simply labeled it as A, this as B, this as C, this as D. Simply. So they have simply given this diagram and they have asked you to identify which tissue growth in the particular growth curve is B or C or D. Such questions can be asked and they are given once in the AIMS examination too. Okay, so let's go deep into this. So this particular growth curve, the body of the tissue, can be categorized into 4 types. Okay, so type 1 is lymphoid, type 2 is neural tissue, and the third type is either genital or general tissue, and the fourth one is genital. Okay, you have one is lymphoid tissue, second one is neural tissue, third one is general tissue, and fourth one is genital. So the curve is projected on that, and it starts from the birth and it's up to the adult. So what is going to happen? They can ask questions. So lymphoid tissue proliferates rapidly in the late childhood and reaches almost 20%, almost 200% of the adult size. When compared to the adult size, for example, if you take this lymphoid tissue, this is your lymphoid tissue, it grows, increases in size, and it becomes 200 times of the adult one. This is the adult one. So when compared to the adult one, at late childhood, it will become 200 times more. This adaptation is basically to protect, because lymphoid and the lymphocytes are basically to protect the child from infection. So child require more lymphoid tissue to protect them from infection when compared to the adult. The next comes is the neural tissue. Neural tissue grows very rapidly and reaches the adult size at 6 to 7 years. Okay, you can see this neural tissue is growing enormously and reaches a value which is almost the same of adult. Okay, at 6 to 7 years of age, this is 6 to 7 years of age, the neural tissue grows to the size of adult. The next comes is the general tissue. Okay, you can see the general one going, steeps, again increases. So coming to the general tissue or a visceral tissue consists of muscles, bones, and other organs. These tissues exhibits an S-shaped, you can see an S-shaped here, S-shaped growth. Okay, up to 2 to 3 years of age, followed by a sudden slow growth between 3 to 10 years. You have a constant growth here, again further increases. Okay, so your general tissue is S-shaped growth curve. First it increases and has a constant value, again it increases. Coming to the genital tissue, up to puberty, your genital tissue will be of zero growth, something like very, very less growth. Okay, but however, the growth rapids at the puberty and reaches the adult size. I hope you're very clear with these curves. Okay, so most preferably they can ask you a diagram based question just by giving A, B, C, D, and they may ask you to identify which tissue it is. The next important aspect that we have to make a note is about this. Okay, so if you take the mechanism of the growth of a bone can grow either by deposition. The remodeling of bone is a combination of deposition and resorption. Okay, deposition means depositing of bone, resorption means resorption of bone. So combination of these two is called as bone remodeling. Okay, and the second one is the change that occurs in the bone. Okay, the changes that the bone deposits and resorption can produce the following changes. One is change in the size. The second one is change in the shape. The third one is change in the proportion. And the fourth one is change in the relationship of bone to the adjacent structures. So all these are most commonly seen. So here in this content, you have to learn about two different terms. One is drift and second one is displacement. And displacement is again of two types. One is primary displacement and the second one is secondary displacement. So coming to the drift is nothing but a cortical drift. Most of the bones grows by interplay of bone deposition and resorption. So whenever a combination of deposition and resorption occur, there will be result in the movement of the bone towards the deposited area, that is the positive area. So this change of displacement is called as cortical drift. Okay, the next one is the important term, that is displacement. So as already discussed, displacement can be either primary or secondary. Primary displacement is basically due to the growth of the own structure, which is leading to the displacement. The best example is the growth of the maxilla, the maxillary growth, because of the growth at the tuberosity region. The growth at the tuberosity region is what it is doing, it is pushing the mandible forward and downward. So this is primary, because the movement or the primary displacement is basically due to its own growth. And the secondary is if the bone get displaced as a result of the growth and the enlargement of the adjacent bone. Because of the adjacent bone, if it is get displaced, then it is called as secondary displacement. The best example is the growth of the cranium. Here the cranium is grown, and it is pushing the mandible forward and downward. Maxilla forward and downward. This movement is called as secondary displacement. So please try to differentiate the primary and secondary displacement, because these are the areas which are really focused in the recent AIMS section. The next important aspect is about this. Okay, so this is, they can give you a diagram based Anlos principle, Anlos expansion principle. Okay, here a V-shaped one. The inner surface of the V-shaped is deposition, and outer surface of the V-shaped is the resorption. Okay, simple, very simple. And most of the structures in the body, they follow this V principle. Okay, the inside is the deposition, the outside is the resorption. And this V pattern is followed in number of regions. Okay, you can add these examples because these examples are most commonly asked. That is the base of the mandible. Second one is ends of long bones. And the third one is mandibular body. And the fourth one is the palate. Okay, so these are the areas where you can see this type of V type of expansion or V type of bone formation in the growth. Okay, I'm done for now, so we'll be continuing in the next session. Thank you. Signing off from Team MDSCONQUER.